If in fact death after surgery in the first 30 days was made its own category of death, it would be in the top 5 leading causes of death within North America. So in the VISION study, what we identified was that through the use of a simple blood test, we've been able to identify a serious heart injury that will increase the patient's risk of dying within 30 days. We've also identified that if in fact we don't measure these blood tests after surgery, we will miss important heart injuries that occur in 94% of the patients. And the reason for this is that the vast majority of patients have their events within the first 2 days after surgery, when patients are typically receiving narcotic and pain medication that can mask typical cardiac symptoms that patients get when they are having heart injuries. How this study can impact patient care in today's world is that it identifies the need to ensure that we measure these heart markers after surgery to avoid missing these important heart injuries. We are starting to see a shift where more and more people will utilize this data to start using measurements of troponins, these heart markers, after surgery as a standard process in patients having surgery. It's important to keep in mind that the majority of people having surgery will do well, and people are getting surgery for important reasons. Sometimes it's to prolong life, and sometimes it's to substantially improve their quality of life. However, because we now do surgery on much older patients who have underlying medical conditions such as heart disease, some of these patients will end up suffering serious complications. And that is because surgery itself creates a significant stress response that in people who have underlying conditions like heart disease, some of them will end up getting complications. Our goal is to find ways to prevent that, better identify it, and better manage these events so that patients can derive the benefits for which they undergo surgery.